Hello, my name is Mark Bonser and I'm a physical therapist at Border Therapy Services, and today we're going to be talking about the science of pain. Most all of us have experienced pain at some point in our lives, and the statistics bear that out. Lower back pain is the second most common reason people visit their physician's office, and 60 to 90% of Americans will experience lower back pain at some point. Chronic pain has become a real problem in our society, and 60 to 80% of people will lose a day of work secondary to chronic pain, especially in their lower back. Pain may be defined as an emotional, unpleasant experience with either actual or potential tissue damage. We're all familiar with the actual tissue damage. An example would be stepping off a curb. You might roll your ankle, and at that point the local tissue, a ligament or muscle, would then become inflamed, and it would send a signal to your brain producing pain. Another example of actual damage would be a nerve in your back that could be pinched or squeezed, and that would also produce pain. There's another cause of pain, however, which is potential damage. That one's a little bit more harder to define. Potential pain, however, is also produced by a physiological response in our system. An example might be if you're afraid of heights and you were on a tall building, you might have a very physiological response. You've not fallen, you've not had any tissue damage, but that fear produces anxiety and can even produce pain at that point. So even without tissue damage, the brain can perceive pain. An example of this might be a common phrase as fibromyalgia. In that example, there is no specific tissue damage, however, the brain continues to perceive pain. At that point, we feel like the nerves and the brain are then out of whack. They are not calibrated correctly. And this is producing pain, although there is no specific tissue damage. At the current time, we don't know why the nervous system will become decalibrated. Does it happen at the brain level, the spinal cord level, or the local tissue level? So how would physical therapists help you treat this? We know that the nervous system is plastic, and that ability of the nervous system to adapt is how physical therapists can help you begin to treat your pain. We can actually reteach our bodies and our nervous system to move with less pain, or sometimes without pain. These results can be achieved with physical therapy treatment and further education. As patients, our brains are very, very powerful, and the more education we have about pain, the better we do. If you would like to know more about pain science, consult with your physician and ask for a referral for physical therapy. As physical therapists, we are here to help you improve your function, decrease your pain, and have a better quality of life. At Border Therapy Services, we have 8 locations to serve you. You can reach us at 595-3535 or go on the net at www.bordertherapy.com.